Interesting times. We are getting a bunch of calls from customers who are trying to come up with unique ways of keeping staff members out of patient rooms, yet still allowing the staff members to communicate directly with the patients. I'm going to talk to you a little bit about how you could go about doing that with Vocera, but what I'm about to show you is applicable regardless of the voice technology that you have. So if you have a nurse call system that's of recent vintage, say last 20 years or so, there's a good chance that there's a telephone interface that can be put to use here. And that's true regardless of nurse call manufacturer. Customer I'm going to show you has a Rollins system, but this would work with other nurse call platforms as well. And the way it works is that the nurse call system has the ability to open up that telephone line interface and actually create a connection between the voice device, say a Vocera badge or an in-building telephone, and that could even be a an extension and the room itself, because every patient station has a unique dialing number. And as long as you know what that magic string of digits are, then you can place a call, and that call won't come through the patient telephone, although obviously that's an option. It'll come through the patient station, and if there's a pillow speaker in the room, it might come through the pillow speaker as well. So as long as you know that sequence, you can put that in some sort of directory, which you can print out. In the case of Vocera, it would allow you to have a an address book entry for it. So in the case of this customer, every patient room we had uploaded an address book entry for, and from a Vocera badge, and again, this could be done from a phone. The caregiver can invoke the Vocera Genie and say, call room 324 patient. And what's going on there if that happens? So if we look in the entry, what you're going to see is the magic numbers. So Q in Vocera basically tells the sequence that this is not a traditional telephone number, and the patient room is 324. And the star sign is going to differentiate between bed one and bed two. For this customer, they only have private rooms, so that doesn't matter. But if there were multiple beds in the room, you would just direct it to that way. And it's a simple way of allowing caregivers to talk to patients and eliminate the need to actually go into the room. And the key thing about this is that you don't have to trigger a nurse call to make it happen. If this is something that you need some help with, this is CareSight's team has a great deal of expertise on that. We'd be happy to help you.